Why are we here? Well, we're here because we face in healthcare in this country a completely unsustainable situation. Medicare is going broke. Premiums are rising 3 times as fast as wages. 46 million people have no health insurance. Spending is twice as much per person in our country as almost any other country in the world. And the outcomes of our system for our people are not as good as they should be. It is critically important that we reform the healthcare system in this country. If we do not, our families' budgets will be threatened, our businesses will be threatened, and the government itself is threatened. This is the beginning of a debate. This is the beginning of a process to amend and improve the bill. This is the beginning of a discussion on the floor of the Senate about legislation to reform the healthcare system. I don't know of a single credible reason to vote against going to consideration of legislation to reform the healthcare system in this country. This isn't about the final result. This is about beginning the discussion and the debate. There is no government takeover of healthcare here. The public option, according to CBO, would get 2% of the American people. 2%. That's hardly a government takeover. And there is no tying of the public option to Medicare levels of reimbursement. There is no cut in the guaranteed benefits for seniors. There is no coverage for illegal immigrants. There are no death panels. And there is no expansion of federal funding for abortion services. Let me say that this plan, let's go to the first if we can, meets key healthcare reform benchmarks. It is fully paid for. And in fact, according to the Congressional Budget Office, it's not controlled by Republicans or Democrats. It is strictly nonpartisan. Congressional Budget Office says this measure before us reduces the deficit by $130 billion over the first 10 years. This bill reduces the deficit in both the short and the long term. It also expands coverage, according to the Congressional Budget Office, to 94% of Americans. It contains critical insurance market reforms, and it contains, perhaps even more important, delivery reforms. Every other major industrialized country has figured out a way to provide health insurance for every one of their citizens. It is time for America to do the same. That is just a moral issue. That is not just a financial issue, it is a moral issue. The Senate Health Plan reduces short and long-term deficits, extends Medicare solvency. Medicare is going to go broke in 8 years. This bill extends the life of Medicare by 4 to 5 years. Extends the solvency of Medicare by 4 to 5 years. It includes reforms to improve delivery of care and reduces costs. I personally think the provisions that Senator Harkin authored that are part of this legislation are in many ways the most important pieces of this bill. And what is interesting is they have received very little attention in the public debate. In fact, many of the most important provisions of this bill have received very little attention in the public debate. Hopefully over the next weeks that will change, and people will learn what's really in this bill versus the rumors of what is in this bill.